Good morning, it's Denise Bowens from CSG University's Spotlight On. I'm here with Heather Monaco, physical therapist and vestibular specialist from Kessler Rehabilitation. Heather just gave a great presentation on rehabilitation for amputees. Welcome.
Hey.
Thanks very much for joining us. Can you talk to us about some of the common challenges faced by amputees?
Sure. I think that one of the biggest challenges is that people don't really know what to expect, and there's so much going on, and they're seeing so many different physicians and going to so many appointments that they're overwhelmed. And then once they get to the stage where they're getting their prosthesis, it's just so much information. So by the time they get to me, there's a lot that we kind of have to backtrack and start to go over and re-educate and start the process so that they can become more acclimated with everything.
And what are some of the ways that patients can improve their own recovery process?
I think trying to be as educated as possible about the whole process makes things a whole lot easier. So asking a lot of questions, making sure you have all the right information to get in touch with the prosthetist and the doctor and your therapist, and even if it's just emailing, I always make sure people can email me anytime when they're home if they have a question, or they can call and reach me if they're having an issue with something. That makes things a whole lot easier.
And can you talk about just some of the ways that physical therapy can help them move through the process so that they can get back to their lives that they were before?
Well, obviously allowing me to know what they were doing before and establishing realistic goals and what they want to be able to accomplish with their prosthesis, that's the first step. And then as long as I know those kind of things and they're verbalizing them regularly, we can work on them on a daily basis in therapy, and I can give them appropriate things to do at home, and that's going to allow them to be able to do what they want to do.
Great. Can we just talk a little bit about how you measure outcomes? How do you know that you're through the process?
Sure. So when I first meet a patient and we were doing an evaluation, we obviously look at a lot of different components to make sure that they're going to optimize their recovery. So typically there are some outcomes that we use to look at their walking and their speed and their balance. We use a timed up and go. We use an L test, the amputee mobility predictor, which gives us a baseline of kind of where they are on day one. And then we establish a program to kind of address some of the impairments that we see. And then typically every few weeks, or definitely every month, we're reassessing those same objective measures so we can compare to how they did the month prior, and that way they can see how well they're doing, as well as their physicians or case managers or whoever's appropriate, and tracking their progress appropriately.
Great. Well, thank you. That was a really informative presentation that you gave to us.
Thank you.
Appreciate it very much. Thanks for joining us, Spotlight On.